Good morning, I'm Marco Antonio Ramirez, and today I'm going to be showing you how to pull blood from a patient. Hi, are you Brianna Ramirez?
Yes.
Alright, I'm going to be your phlebotomist for today, and I'm going to be extracting some blood for you as a doctor ordered. So one of the first steps you do when you walk into the patient's room, or if you go to the patient, you have to make sure you have the correct patient and check all their information with them, because you never want to have the wrong person. Once you make sure you have the right patient, you introduce yourself, who you are, as I did at I'm the phlebotomist for today. Now, once you introduce yourself, you have to make sure you explain the procedure and what you're going to be doing to the patient so they know what's going to be happening. Alright, once you get into the room, make sure you identify where everything's at. So you have your safety container, your gloves, your cotton, your syringe, your tourniquet, the vacuum tubes, and everything else that is necessary for the procedure. Once you know where everything is, you can proceed to go ahead and wash your hands. Once your hands are washed, you can ask some general questions to the patient. So, have you taken blood out before?
Yes.
Is there an arm you prefer?
The left arm.
The left one, alright. So once the patient tells you that, you can go ahead and put on your gloves. You have to treat every patient as if they're infected, so always make sure you put on your gloves. Alright. Once gloves on, you make sure their hand is in a good locked position, and you look at the bend of the elbow. You grab your tourniquet once you can see a vein, and place it exactly 3 fingers above the bend. From here, you'll be looking for a bulging vein. Once you can find a clear, bulging vein, you proceed to grab your cotton and some alcohol. You thoroughly clean the area until you think it's just right. Alright. You grab your syringe and you uncap it, eye level. As you're about to enter it at a 45-degree angle, you slightly stretch the skin to make it easier for the insertion, and you proceed to stick it in. Now that it's in, you use your hand that was grabbing the plunger, and you grab one of your vacuum tubes, and slightly push it in without moving the needle as much to cause less pain. Once it's done, you invert the bottle, and you grab every other bottle necessary. Now that I have all the bottles necessary, before taking out the syringe, you must always undo the tourniquet. You grab a new fresh piece of cotton, place it over the syringe, and extract the needle, making sure no blood squirts out. Now that you have your syringe here, you must always cap it safely. Never use your hands. And then place it into the safety container. Now you grab some bandages or whatever is available to you, and you wrap it around the patient's arm. You can also explain to the patient, so today you won't be able to do any heavy lifting for like the next 12 hours. Don't try doing a lot of exercising, get some water to rest. So they know general information about what to do and what not to do. Now with the patient being here, you grab your bottles, and you grab the patient's information on the sticky. You place it around the bottle, all the bottles, and you show the patient to confirm it's them. Is this you? Is this you?
Yes.
Now that the patient's confirmed it, you can take the bottles over to the designated area. Sometimes there's a basket, sometimes there's a whole organized place where you safely place it and wait for the next procedure. Now that this is done, you can easily just take off your gloves and dispose of them properly. Thank you for coming today. That was it. You're done. You can say goodbye to the patient, and that's how you pull blood. Thank you.